Hi, I'm Dr. Astha Dayal and I'm a consultant in gynecology with CK Birla Hospital in Gurgaon. And today we're going to talk about a very common question which all the pregnant women have is how do we know that we are going into labor? तो जब भी लेडीज़ का थर्ड ट्राइमेस्टर शुरू होता है उनके मन में बार बार ये क्वेश्चन आता है कि हाउ विल आई नो दैट आई हैव गॉन इनटू लेबर और हाउ विल आई नो दैट आई नीड टू सी माय डॉक्टर. So we really need to understand that what are the signs of approaching labor. सबसे पहला साइन होता है लेबर पेन. नाउ जिसको आज तक कभी लेबर पेन हुआ नहीं है, दे डोंट नो व्हाट रियली लेबर पेन इज़. सो हाउ यू अंडरस्टैंड इट इज़ दैट इट इज़ अ पेन जो आपके पीरियड पेन की तरह होता है, जो आपके बैक से आता है और बैक से फॉरवर्ड फ्रंट की तरफ आता है, जो आपके लेग्स में जाता है. एंड एवरी वुमन हैज़ अ डिफरेंट परसेप्शन ऑफ द पीरियड पेन. सो इट इज़ समथिंग लाइक अ पीरियड पेन, बट यू ऑल्सो हैव टू अंडरस्टैंड दैट इट स्टार्ट्स कमिंग अगेन एंड अगेन and it starts becoming more and more severe. So it might come maybe once every 1 or 2 hours, then it starts coming once every half an hour. So it is persistently coming and it is increasing in intensity. अगर कभी कभी आपको पेट में थोड़ा सा टाइटनिंग फील होने लग जाता है फ्रॉम द सेकेंड ट्राइमेस्टर, जिसको हम ब्रैक्सटन हिक्स कॉन्ट्रैक्शंस बोलते हैं. सो अगर ये ब्रैक्सटन हिक्स कॉन्ट्रैक्शंस आपको पहले से ही हो रहे हैं, दीज आर जस्ट टाइटनिंग्स दैट यू फील इन द यूट्रस एंड देन इट रिलैक्सेस. सो द सेम थिंग व्हेन इट स्टार्ट्स बिकमिंग पेनफुल, इट बिकम्स द लेबर पेन. Now some women don't understand the difference between false labor and true labor. Sometimes people feel that they feel a lot of tightening after eating food, and then once they pass stool it gets better, or some bloating that they feel. That is not really a labor pain, because this pain is in the lower part of the tummy, not in the upper part of the tummy, and it also is a similar pain to period pain, not a tummy cramp. So this is how you know. But even if you're not very sure and if you're confused about whether it's a labor pain or not, you should still come to your doctor and then we can examine you, we can check whether this is labor pain or not, and if it's false labor, we send you back home. So it's not a big deal. So any sign that you feel that a pain is coming again and again and it is not stopping on its own, it is persistently coming, you must visit your doctor. The second sign is leaking. Now leaking means के पानी छूटना, and this does not mean just a white discharge. It means के it's going to be a leakage of a fluid which is as thin as water. मतलब पानी के जैसा पतला पानी छूटना, which means that you might feel that you've passed urine or you are having some drop dribbling which you cannot control. So this usually, if it starts happening, it doesn't stop on its own. So how you can check for that is you can probably keep some cotton in your panty and check whether it's getting wet. Then you must visit your doctor again. The third sign that we have is of bleeding. Any kind of bleeding that you have in your third trimester which has never happened before, then you must visit your doctor and you must inform your doctor. Sometimes if your doctor does an internal check, after that maybe 1 or 2 days you might have a little spotting or a brownish discharge. Sometimes you could have a brownish blackish show kind of discharge, which is also okay, but a fresh bleeding needs to be informed to your doctor, and that's sometimes an emergency. Now the fourth sign is if you're having decrease in your baby movements. Now this is a very important sign. In the third trimester, after the 28-29 weeks, we tell you to start keeping a count of your movements of the baby. Now अगर आपको end of pregnancy after the 9th month has started, if you feel that every baby has a different pattern of movement. Some babies move more during a particular time, they don't move for some time, some few hours when they sleep. So you know the pattern of your baby, and if you feel a change in that pattern, that the baby has actually started moving much lesser than it was, then also you must tell your doctor. And sometimes if you're already term at that time, it needs to be then in that case you need to be delivered. So these are the signs that you should keep an eye on, and you should inform your doctor if any of these signs develop. If you have any further questions, you could contact me by calling up the CK Birla Hospital for an appointment. Thank you.